Welcome to Stallside Podcast.
Welcome to Stallside. How are you doing today, Bart?
I'm doing very well, Peter.
That's good. We've got a great podcast today. I'd like to introduce you to Dr. Brad Tanner.
Hey, Peter. Thank you.
It's great to have you here, Brad. So, tell us a little bit about yourself.
Sure. I'm a veterinarian here at Rood and Riddle Equine Hospital. I have a general practice that I do ambulatory, but then my primary focus is dentistry. I'm a boarded specialist in the field of equine dentistry. And so that means that I do a lot of dental exams, some oral surgery, jaw fracture repairs, oral maxillofacial procedures. And when I'm not doing that, I'm usually spending time on the family farm with my wife and 2 kids, and we raise some thoroughbred foals every year.
Now, I noticed you're wearing your Kentucky blue today. I don't know if that was intentional, but Brad's a Kentucky guy.
Yeah. So I'm a Kentucky through and through, bleed blue, and my wife and I met at the University of Kentucky.
How many horses you got?
We have 2 broodmares. Yeah. And 1 foal. You can do the math. Maybe I'm better at dentistry than I am reproduction.
Yeah, but you know that you can always get more, can't you? Really, you got the foundation mares for this huge herd that you're going to have.
Yeah, we're going to stay small.
Yeah, but let's face it. I mean, horses have teeth, and you're here today to talk about teeth. So, just for everybody out there, why float teeth? You know, there's plenty of horses through history that didn't get their teeth floated, and they seem to do okay. So, why do we need to take care of these?
I agree. Those ancient horses were pretty awesome. You know, there was no cavemen running around with dental rasps floating their teeth, and they did quite fine. What we have to keep in mind is what's changed since that time. Those horses have evolved over millennia, you know, and those teeth are constantly growing. They're nice, long molars, hypsodont teeth, completely different than what you and I have. You know, we have a mature mouth when we are 18 years old. Horses, their teeth keep growing their whole life, and when they're grazing materials that they were evolved to graze, those teeth wear out pretty quickly. And so those are your thick grasses, those silica grasses.
I was going to ask you, they're eating rocks or something?
Yeah. So they're like, you know, if you run your hands through a bunch of warm season grasses, your zebra grasses, your things that you have decorative around your house, you'll cut your fingers sometimes. You get those little cuts on them. Right?
Yep.
That's because there's a lot more silica in it. It's a lot sharper, thicker material. So you got to grind on that. You know, we've got all these little manicured, beautiful grasses everywhere here in the United States, and all the domestic horses, for that matter, around the world, are grazing mostly pastures that are, you know, 6 to 18 inches tall, pretty soft, high water content, low sand content. So I say that to say, short answer is that they're chewing a lot more water and a lot less sand. And so
Gotcha.
The tooth isn't wearing out like it would have on these ancient horses that would have eaten a much different diet. Now, the other thing is life ages have changed a little bit too. The expected life age of a ancient horse might be significantly different than a horse today.
Yeah, that's a really good observation that you make, because, you know, horses, since they've been domesticated, they are eating different things than once upon a time they did. And it's probably fair to say that the texture of the feed that they eat is not going to wear their teeth to the standard that it should in the environment they evolved in. So who should float my horse's teeth? You know,
I would say, as with any procedure with your horse, it's better to find the most highly trained, educated person you can. So in all cases, that's going to be, you know, your veterinarian that you've got a relationship with, or someone that they can recommend to you that makes that a focus of their practice. So you want somebody who's educated in that species, which in this case obviously is the horse. You know, you want somebody who's educated and familiar with looking at mouths and looking at problems that could potentially be present, and somebody who understands that this mouth and these teeth are attached to a body. And so it's an entire animal here. We can't just talk about the teeth. We have to talk about, you know, is my horse healthy enough to have this procedure done? Is this appropriate time based on whatever other problems may or may not exist, the general health of your horse. So the best person to do that's going to be your veterinarian.
But there are a lot of people out there floating teeth. Can we just hit that directly on that? There's a lot of people floating teeth that are not veterinarians. And what can you get from a veterinarian that maybe you can't get from just somebody who is It's floating teeth.
Yeah, no, you're right. We should just talk about it head on. Yeah, there are a lot of people out there that are trained in some form or another of floating teeth, and that is reducing these overgrowths of teeth that are going to form. And so they're trained to do that. That training is going to look a little bit different than your veterinarian. Your veterinarian would have spent, maybe 7 or 8 years of their life in college and veterinary school and training programs. And so they're going to understand that tooth is attached to an entire body, and more general health concerns that are associated with that. They might recognize during their examination phase, what are these abnormalities? What could they mean? How do I best address them? How do I make a diagnosis? And so it's just going to be knowledge. It's going to be quite different. Their training's quite different. So I'd say that's the biggest difference.
Yeah, and how about the practicality of what other diagnostic tools do you use that maybe a lay dentist wouldn't have access to?
As a veterinarian, I'm going to have a whole different set of tools. I'm going to have access to sedation. You need to be a licensed veterinarian to administer sedation to a horse for an examination. I'm going to have the ability to make a diagnosis, based on the Veterinary Practice Acts in many states, if not most, to form an actual diagnosis, you need to be a veterinarian. But specific to your question, as far as equipment, I have oral endoscopies. I have ways to look at a tooth to take it from being 2 inches by 1.5 inch rectangular and then zooming in and making this thing, 12 inches wide. On a computer screen. And so I can look at every little detail within that tooth and understand what those pulp horns look like, some of the internal structures, and what abnormalities might be present. Additionally, I'm going to have access to radiographs. Imaging is a big part of what we do looking at our teeth. And that may sound strange to some owners listening to this right now, but it's no different than you and I. We go see our dentist, and what do? They take radiographs. We can only see what's along the gum. I just told you these horses' teeth are quite long and they grow their entire life. These teeth start off about 4 inches long. What we can see in the mouth is only about 1 inch. So there's a whole lot of tooth up inside their skull, up inside their head, right, that we can't see. And so radiographs allow us to look in past the gum line and see, is there a problem? And usually we are concerned there's a problem if we pull out a radiograph machine.
You make a really good point before when you talked about teeth that we have and teeth that horses have, because it's only natural that if you're looking at your animal and maybe you don't know the mechanics of exactly what's going on in there, you're going to sort of apply what you know yourself to your animal. And the dentistry is, when you go to see the dentist, it's the same thing, right? Dentistry, get the radiographs taken, someone gets my mouth and pokes around. But you mentioned also about horses' teeth being different because they're eating different things. So horses chew differently, I think it's fair to say. And so how does the way the horse chews affect the formation of abnormal structures in the mouth, or how does it call the sharp points?
Yeah. So those sharp points that you just said, that is basically the areas that are being floated away. And floating is an old plumbing term, basically mean to leveling off. So there's enough textbook answers for today. But anyway, that's where the term floating comes from. Everybody wants to know, why is it called floating teeth? And so it's an old term that goes back to the Romans, but it has to do with rasping away these overgrowths. And everybody can look at their horse's head and realize that top jaw is a lot wider than the bottom jaw. And, you don't have to sit in an anatomy class and go to vet school to figure that out. And so when they chew side to side, it's clear that lower jaw is not going to come all the way across those big upper teeth. And the same thing side to side. So they chew side to side when they're grazing. And I say that when they're grazing because horses, if they're given the opportunity, will preferentially graze 16 hours a day. That's a long time. It's a lot of grazing. But I also say when they're given the opportunity, because think about what we've done when we domesticated them. A lot of horses now are stalled a number of those hours of a day, whether they're having a foal by their side, whether they're a performance horse. Some performance horses are stalled most of the day, so their diet's changed. So instead of chewing side to side as they're chewing those grasses and hays, they're eating grain now because we're trying to supplement them with more energy so that they can perform, whether it's producing milk, whether it's exercise and performance in a show ring. So as we're given those concentrates, it's no different than Dr. Barber over here or yourself. Let me give you a peanut. You're going to chew that peanut different than you're going to chew your salad.
I like my peanuts and Snickers bars, by the way.
There you go.
I got one question. Yeah. What's a salad?
So when I give you both of you a Snickers bar, then no salads, you're going to move that peanut over with your tongue between your teeth and you're going to chomp straight down, right? And everybody listening to this can understand what it's like to chew a peanut or any other thing that's a hard structure. It's the same thing for your sweet feed or your pellets. You're going to crunch straight down. So when you're chewing down rather than side to side, those teeth were made to be a grinding surface. They're supposed to be a hay machine, grass machine. And so now we've changed what they're eating and how they chew. So if they're not chewing side to side, those teeth are going to get longer and longer on the outer periphery of the top teeth and actually the inner portion of the tooth on the lower teeth. And that's the area that we're floating. And that's why floating is so important now, whereas maybe it wasn't as important in those ancient horses.
You know, Brad, that's just a fantastic point to bring out to people, that changing management of the horses has totally changed the way those teeth function throughout the horse's life, because they're not getting the wear and tear for the duration in a day and in the chewing motion that they should have grazing pasture with what we've done, changing their feed sources. So why should my horse have a dental exam and floating? I mean, you've touched on that a little bit, but how important is tooth care, do you feel? I mean, there's a lot of other things that can happen to a horse. There's a lot of other requirements to look after that horse and maintain it. So why do you put teeth right up there at the top?
Well, I would say this. There's a kind of a checkbox list of things as every responsible owner thinks about, and that is kind of your annual immunizations, your vaccines, your deworming, calling the blacksmith, the farrier, having the feet taken care of. And somewhere in there needs to be a checkbox for teeth, whether that's annually or whether that's twice a year. And the reason why I think it's important and why it is important is because those teeth are responsible that's the very, very beginning of your GI tract. Okay, we all know of all the problems horses can have with colic and other issues, upset stomachs, and how that influences their general health. Well, the very, very beginning of the gastrointestinal tract is the mouth. And they have to be able to chew. They have to be able to eat pain-free to be able to survive. And so looking at them, there's plenty of overweight people that might have dental problems. And there's plenty of overweight horses that may have dental problems. So using their weight alone, saying, this one could stand to lose a little bit of weight. Well, maybe I could too, but I still want to go to the dentist and I still want my teeth looked at because I don't want to be in pain when I'm chewing.
Yeah, that's a good point. Given what I do, I'll have these horses come into the clinic for a workup because unfortunately, the owner's very distressed that the horse is not putting on condition commensurate with the amount of feed that it's getting. And it's actually sobering the number of times when I look in the mouth and then I'm calling you to come and fix the teeth up. And in a way, that's good news to give the client because they say, hey, here's a fixable problem for you. But it should never have got to that point where the horse has lost that amount of condition and they've had the distress wondering what serious condition their horse may have.
Hey, you're exactly right. I would be afraid to know the number of horses you've called me on that exact same situation. It's startling. And the owners, it's not from neglect. The owners just, a lot of times in those situations, just it's that little checkbox I just mentioned that just got missed. Sometimes for a few years, sometimes for a couple of years, or maybe someone was providing that service, but it just didn't quite meet the standards of what that horse needed. And so that's something that happens pretty frequently. So when we think of dentistry for ourselves, we really think preventative is what we really think. We don't want to be going in for a root canal. We don't want to be going in once we have pain. We'd like to prevent that. And so we do things like brushing and hopefully flossing and things like that. These horses, it's the same thing for them. It's very much preventative. And floating away these sharp areas and allowing those teeth to make a nice long grinding surface is the best thing for them. There's 24 teeth back in the back that no owners ever get to see unless they look in over my shoulder or somebody's shoulder. When you and I know that there's 36 to 44 teeth in a mature horse's head, a lot of times you guys listen as owners, when you raise your lips up, you're thinking that's my horse's teeth. And those really aren't the heavy hitters. Those are the incisors. That's their pretty smile. But the heavy hitters doing the work are in the back. And
you got to get to almost your elbow to get to them.
You got to get in there, right? And so there's 4 different rows of 6 teeth each, and they're supposed to fit together as one solid brick. And so that brick needs to be flat and level and a good grinding surface on all 4 quadrants. And if something is amiss, up, down, short, long, then things start getting balled up and things start causing problems for the GI tract, for the mouth itself.
You're looking on dental care of the horse as a very individual thing to that horse.
That is correct. I think it is very unique to every horse. I like to think I'm a little bit different than you are, Peter, and hopefully I'm a little bit different than Dr. Barber.
Yeah, there's.
I concur.
Yeah,
No.
yeah, you're taking a slippery slope there.
I do want to know when you are working in a horse's mouth. Did you talk to him a lot? Like my dentist does. He won't. I don't know. Does he want a response when he's got both hands in my mouth? Maybe you could help me out with that because he asks me questions and I go, I can't answer you. You got your hands in my mouth. But.
I wish I was a horse communicator and I could get those answers. But I do ask a lot. You bring up the right question. I do ask a lot of questions of the people around, whether that's a trainer, a manager. Sometimes it's the groom that spends the most time with the horse and actually knows the horse the best. So if this is a performance horse, I'm asking questions about bit placement. How's this horse handling tack? How's this horse performing? Are you having any problems? Are you having trouble in collection? Talk to me about what you're seeing. Are there any primary concerns? Now, in the pastured animal or the brood mare, the horse that's outside grazing, I'm still asking questions. Have we been gaining weight? Have we been losing weight? Have you had any primary concerns? Is there a history of trouble? So yeah, there are things I'm asking. Any changes in diet? And sometimes I may have recommendations on diets based on things that I'm finding.
Yeah, and I appreciate that you said, you talked about this being an individual issue. And I do think that's one of the differences that you can get from a veterinarian who specializes or who does a lot of dental care. That dental exam is so important because just floating, if you've got 10 horses and you want to get them all floated, that's not the same thing for every single horse. That dental exam is so important.
I agree. I mean, the dental exam, I lecture in a lot of continuing education meetings in this country and others, and regional and state markets as well. And the examination is the most important part of my 10 or 15 minutes with your horse. The floating the teeth, I can train a lot of people to float teeth and get rid of sharp edges. It's identifying what is best for that horse, not making it cookie cutter for every horse.
Right.
Yeah, I think that's a really good point because people want to do things on the calendar, right? They can vaccinate at a certain interval. They want to deworm at a certain interval, which, let's face it, we've found out that that's not correct in every situation. I think they want to do the teeth on the horse at a certain interval, and it just doesn't work because I'm sure you've seen some that they need to be seen every 6 months and some can go a couple of years. So when you're looking at those horses, what's your equipment? What sort of setup do you like? Talk to me about the benefits of sedation. And, we're going to empathize a little bit with that horse. Is there any pain involved in what you do?
No, you're asking me all the hard questions now. You buttered me up and here we go, right? So
the trap closed.
Yeah, here it is. So the equipment, there are some things that I need to do that are safety precaution for my fingers. And that is, I'd like to not get bitten. And I'm guessing everybody listening right now at some point has been bitten by a horse. And more times than not, it may have been your fault. It's been my fault plenty of times where I reach in and try to feel if those teeth are sharp. And why I do that, I don't know. I should be the most educated person in this field and understand that's not a good idea.
Brad, you just get in the zone and away you go. My mission in life is not to be called three-fingered Pete, so I keep my hands out of the mouth if possible.
So to answer that question, as far as equipment, I do use a mouth speculum, something that I can safely open their mouth and look back elbow deep, as Dr. Barber had said, into the back of this throat. I want to be able to see all the surfaces of the throat, right? There's a lot of things I'm looking at other than just teeth in this mouth. So I'm using a mouth speculum to do that. I'm also using something to suspend their head. Usually use a headrest so they can just rest their head. They're nice and quiet. They're nice and quiet because I've used sedation. And that sedation, you asked me, is that really necessary? Well, it is for me. And I think it is for your horse. Once I put a mouth speculum on the end of their mouth, my dentist will tell me, please don't bite down. Please sit still. Hopefully he doesn't have to tell me that now. But he'll tell my kids, hey, don't bite down. Please sit still. I'm having trouble with my communication skills. So I do use sedation to have them rest quietly so I can do a thorough exam, see all surfaces of the mouth, and then perform whatever floating might be necessary. As far as the floating goes, I use power floats, power tools. Years and years ago, power tools came out and they were pretty aggressive and they were pretty damaging to horses' mouths. That was because they were carbide. And so when you think of carbide, think about woodworking, think about taking away aggressive amounts of tissue or structure. Now we're using split diamond grit burrs. So think of sanding. So I can turn my float on and challenge anybody who's floating your horse's teeth to do this at home. I can turn it on my hand or on your hand as you're standing there, and we can have a conversation. And when I get done, I'm not bleeding, I'm not in pain, and there's been no heat because this is a water-cooled instrument that cannot possibly hurt your horse. So when I get done, the answer is no, he shouldn't have any pain. I used to get asked all the time, how many days off does he need? Well, if I floated your horse and I haven't found any problems, you can ride him that afternoon. There shouldn't be any need for time off at all.
We touched on the individuality of dental care for horses. So I have my horse grazing at pasture, or I have a performance horse. You mentioned earlier about maintaining a lot of stall time with those horses and a different diet. What's the differences in the need for dental care between those groups of horses, and even with disciplines within certain breeds? What specialty things do you need to do so those horses have the best mouth possible?
A lot of that comes with experience, having looked in a lot of mouths. One of the big differences, your first question was pastured horse versus stabled horse in performance. Those pastured horses, they're grazing a lot more. They get a chance to graze all day. They're going to wear a lot more tooth surface down than those stalled horses are. And those stalled horses are eating more concentrates. So they're going to need to be floated more frequently, usually twice a year. It does change a little bit with age. As far as per discipline, understand how those horses go. If you're working in a quarter horse world and you're working with reiners and you're working with cutters, you're using a lot of leg pressure. You're not using your hands a lot, or you're not going to mark very good scores. Those are not going to be very good rides for you. If you're in a dressage ring, it's a little different. You're marking in a double bridle and you're not using your legs a whole lot. So you really need to know your disciplines and what kind of bits are going in the mouth. You also need to know head carriage. If you're working on thoroughbred racehorses, there's not a whole lot of contact. They're pretty much running with, maybe they're rating on the backside, but then as soon as they make a turn, it's a full head out in front of you and they're just going. There's very little contact. I'm convinced after working in several racehorses' mouths that they can do just fine with pretty sharp teeth. You do the same thing with the dressage horse who's in collection, who's in a frame, and those riders are really astute with putting them where they need to be to get through their dressage scores. Those horses, a small little imbalance along the occlusal surface that could be an eighth of a millimeter is enough to cause them to have TMJ pain and start tipping away with a bit. So it's really unique to different disciplines, and I think it's important to understand that they're not all the same. A dressage horse goes very different than a thoroughbred racehorse.
Right. That's a good point.
That's a really, really good point. I mean, there is just many different facets to these horses that I wouldn't have considered until you mentioned it. So besides the different disciplines, horses are going to age, as we all do. Our dental needs change as we get older. What do you see as the progression from, say, a yearling through to a geriatric horse? Take us through the major life stages and the things that you're looking at during those times that allow you to make decisions to get those teeth where they need to be.
Sure. I'm glad you asked that. Yeah, and I would start with horses are living so much longer. I mean, I can remember when a 20-year-old horse was an old horse. If I knew somebody had a 20-year-old horse as a kid, I was like, wow, that thing's ancient. I work on 20-year-old horses every day. There's 20-year-old horses performing at high levels. There's Olympic-level horses right now competing at that age. And so now we've pushed that back almost a decade. Now 30 seems to be an old horse. And we work on horses in their 30s routinely. But to answer your question, those different life stages, as a yearling is usually the first time I'll look at a horse. And we do float teeth on yearlings. That's usually when we recommend beginning. We can at that point start determining if there are skeletal abnormalities. That's kind of where the exam comes into play. Not all horses are going to develop symmetrically. You like to think the left side is going to be the same size as the right. That they're not always mirror images. And so sometimes you can get in there and you can change the way they're chewing by the way you float them and stop something that was going to propagate into a problem down the road at a very young age. Now, by the time you get into that next life phase of 2, 3, 4, 5, up to about 6, when all these teeth are growing in, they're losing their baby teeth. It's no different than those of us who have kids at home that have pulled their own teeth and wiggled them and tell you, hey, Dad, I got a loose tooth over here. It's the same thing for these horses, except they do a poor job of communicating that to us unless they're in work. And so a lot of these young horses, your futurity horses in your quarter horse world, and those of us who are starting to train thoroughbreds during that same time frame. And warm bloods tend to start a little bit later, but they'll still start during the time as these adult teeth are coming in. These baby teeth, we'll call them caps, are ready to come off. And so that's a life stage. We're going to look at them every 6 months during this life stage because we want to make sure that the teeth do erupt, do come in. If they don't, that could be an indication of a problem. We don't want to get in there and start yanking off baby teeth just because our calendar says, aha, this horse is exactly this age and my book says this is when it should come off. Instead, we want to treat them all as individuals, just like we'd like to be treated by our dentist. But if something comes off a little bit too early, that could be a problem. It could present a risk for that tooth's health long term, or it could just provide an area for a tooth to overgrow to fill that void. And that's when you start getting imbalanced mouths. People use the term wave mouths. This is basically saying that one tooth is longer, and instead of having a nice solid brick of 6 teeth with a chewing surface that's nice and flat, suddenly there's one area that's much longer than it should be. And so if we identify that at this horse that's 2, 3, 4, 5 years old, 6 years old, we can reduce that. And we can get this back into a normal chewing surface where everything works in unison, and then we don't develop problems. There's many problems that can develop from that down the road. Now, as they age, that group of horses from, let's say, 8 to 15 or 20, those horses, their teeth won't erupt at the same speed as those young horses. And it's not only that it's not the same speed, the composition, and this might get a little too much scientific for anybody listening, but the composition of the tooth is different. Young horses' teeth are much softer. And so as they chew and grind, the area that doesn't get chewed away ends up getting longer. And now as that tooth ages, the quality and the quantity of the cementum and the dentin and the enamel changes inside of it. And so that tooth becomes a lot harder. It becomes rock hard. The teeth don't grow as quickly. So, that may be a group of horses, if they're not in work, that you're just floating them once a year. Or maybe you're checking them and saying maybe they don't need to be done this year. The examination is the important part. It's not the tooth floating. To continue on this, as far as age groups, and you got that older group, and we'll just say older than 20. And we can make that number different for many different horses. Some horses look old at 20, some horses look old at 18, some look young at 25. But at some point, that tooth is going to start getting shorter, because we said we started with a tooth that's about 4 inches long, and that's true until we get to be about 20 to 25, and then suddenly some of them start wearing out. And so we want to look in those mouths at those horses more frequently. We're going to look at them every 6 months, commonly, and there'll be some point where those dentition changes. It might be 30 for some horses, but we'll start looking at every 6 months, trying to make sure that they can still chew and that they're not a choking hazard, or they're not going to be that something's going to happen that's going to predispose them to colic.
Could you back up just a little bit and talk about some of the other individual problems maybe we get with teeth? Because I think a lot of people have a misconception that dental work is just floating the teeth and knocking them off, because they don't have the same diet that we do, right? They don't have the Snickers bars that Pete and I eat. So what are some of the problems that we get into with some of these horses that maybe people might not think about?
Yeah, I'll be happy to tell you about that. One of the biggest ones is periodontal disease, gum disease. It happens to us, and it happens to horses as well. And periodontal disease is a welfare issue. It is very, very painful. It's the most painful thing I deal with in a horse's mouth. Those horses are quite uncomfortable. They may be sedated with Dromosedan or whatever sedation we're going to use that's safe for the horse, and be resting quietly on a headstand with their mouth open. And the minute you reach in and touch that tissue, they become awake, and it's clear that they're painful. And a lot of times that is preventable. If we're doing preventative dentistry and we're checking them regularly, we can stop that from ever happening with routine, good quality dental care. Once it does happen, it's important to recognize it, because that's a miserable horse. That's a horse that's in pain every chew, every bite, and that could be 16 hours a day if it's a horse out on pasture. So that's a miserable existence. So that's one of the big common problems. The other thing is broken teeth. Teeth do break, and I always get asked, was he chewing rocks? How'd this happen, right? Well, usually it comes from cavities. And that'll surprise some of the listeners that horses do get cavities. And it's not from the peppermints you're feeding them. Keep giving them peppermints. Keep giving them treats. Love on them. But they get cavities, no different than you and I. And it's typically developmental. They could be predisposed to it from the time they're born because of the lack of structures that form inside the tooth sometimes. And sometimes it's because a cap came off, a baby tooth came off too soon. But horses do get cavities, and those cavities weaken the structure of the tooth. And as a grinding surface, we've all been bitten at some point. It hurts. Along the incisors, they can bite with a force of 120 pounds per centimeter cubed. So that's a lot. Back in the molars, it's 200 pounds. That's 2,000 newtons of force. So if you can bite that hard and you have a weakened structure with a cavity, it's just a matter of time before that tooth will split. So, there's things we can do. We do cavity fillings, we do restorations to try to prevent that from happening. Or if it's already happened, we'll take radiographs and try to decide, is this painful for your horse? Maybe it's broken in a place near a pulp horn. Maybe it's not. Maybe we just say, let's monitor it. But there are a number of times where that's something we'll find, and that's the value of doing the dental exam.
How would you say to plan for successful tooth health and dentistry throughout the life of the horse?
I would keep in mind that prevention is the goal. Prevention of problems is the goal. No different than for ourselves. And find the most qualified person you can, build a relationship with them, talk to them about the needs of the horse, what the horse is being used for, whether that's pasture pleasure or whether that's performance. And then try to individualize the program for that horse based on what the goal is going to be. And know that it's going to vary, that you can't just make a little box and say it's going to be January 1 every year. It's going to vary based on those age division times in this horse's life.
Okay, Bart, anything to say?
No, I think that was great. I think you covered a lot of it. There's still a lot more out there, and there's obviously quite a few more problems that we could talk about. But I think that wrapped it up well. So if you have a question for Dr. Tanner, send us an email and we'll pass it along.
Brad, it was great having you here today. It's a very quick tour through dentistry, and no doubt we'll get you back another time. We can go in a little bit deeper on some of these things which owners face with their horses. So that's our podcast for today. I hope that was informative and enjoyable, and we'll see you next time.
Rood and Riddle Veterinary Pharmacy is a full-service veterinary pharmacy located in the heart of the Bluegrass, Lexington, Kentucky, the horse capital of the world. We are the official pharmacy of nationally recognized organizations like the Breeders' Cup, the National Horse Show, and the United States Hunter-Jumper Association. As a full-service veterinary-only pharmacy, we offer a multitude of options in care of your patients, giving you and your clients a little peace of mind in uncertain times.